Intellectual Disability by Briana Zavala. What is it? Intellectual disability refers to neurodevelopmental conditions that affect functioning in two areas. The first is cognitive functioning, such as learning, problem solving, and judgment. Adaptive functioning, activities of daily life such as communication skills and social participation. Additionally, the intellectual and adaptive deficit begin early in the developmental period, typically before the age of 18 years. For diagnosis, intellectual disability affects about 1% of the population, and of those, about 85% have mild intellectual disability. Causes, identifications, and tests. An intellectual disability can have pre-birth causes, causes that can happen during birth, and causes that can occur during early childhood. Genetics, inheritance, and infections are some pre-birth causes, while hypoxia, which is the lack of oxygen, premature birth, and any brain injury during birth are causes of intellectual disabilities that can happen during the birth. Some causes that may happen during early childhood are injuries, accidents to the brain, heavy metal exposure, especially to mercury or lead, infections like measles and meningitis, and tumors or seizures. Identifications. Usual identifications for intellectual disabilities show while the individual is showing difficulty with academic skill sets, domestic, and social skill sets. Some intelligence-related symptoms you may see would be slow learning and reading, trouble with reasoning and judgment, and slow critical thinking skills. Some adaptive behavior signs would be slow social development, slow toilet training, trouble understanding time management or money, and trouble with understanding social boundaries. Some tests would be laboratory testing of blood and urine, genetic counseling, or imaging tests. Once these tests were concluded, there are many different types of intellectual disabilities. There are mild cases where the mental age of the individual is nine between 9 to 12 years old, and they may have trouble with learning complex tasks. Moderate, the mental age of 6 to 9 years old and can communicate using simple language. Severe, mental age from 3 to 6 years, and they use single words, phrases, and gestures to communicate. Profound, mental age of 3 years or below, usually communicate non-verbally and understand some gestures and emotional cues. They would require 24/7 medical support and care for this type. I've provided an infographic about early signs of intellectual disability by age. We have infancy with 3 signs, toddlers, preschool, and school age. Here are just some signs for infancy. We have delayed motor milestones or feeding difficulties, limited response to stimuli, toddlers, few words or gestures, difficulty following directions, problems with coordination, preschool, limited vocabulary, struggling with understanding, difficulty with basic tasks, and in school age, difficulties with reading, writing, math, or trouble with problem solving, and poor social skills. Teaching strategies. I've provided 3 teaching strategies that can help with a student with intellectual disability. So the first would be to teach routines. By teaching routines, it can create predictability and lets the students really focus on learning new information and topics, and they can plan and on what to do next. Try to establish clear routines like a morning routine or a specific subject routine. For example, in the morning, students know to enter the classroom, unpack, begin their silent reading every morning without constant instruction as is an established routine. Number 2, use mnemonic visuals. Mnemonics are like using rhymes or acronyms, helps the students remember information by associating it with something simpler. Having them use visuals can help with memorization. An example of a mnemonic could be never eat soggy waffles. This could be a mnemonic used for the directions north, east, south, and west. The teacher can create a visual with the phrase and have like a compass with the organized labeled in the order so that it can help with distinction and to understand the order that the directions go in. The last strategy is simple instructions. By breaking down instructions into simpler ones, it makes learning less overwhelming and it helps students to be able to reach the final goal more efficiently and can help build their confidence as well. For example, when instructing a craft activity, instead of saying a long paragraph of instructions like, okay, class, let's make a project replicating the 50 states by cutting up pieces of magazines and so forth, say, get out your glue stick, everyone, and wait for them to take out their glue stick, and then take a piece of paper and cut it to your desire. And you wait for them to cut up their piece of paper. Next, once most of them are done, you continue with the next step and so on. And by making these instructions simpler and breaking them down, and try to go at the student's pace so that they can understand better. And new medical research. This is an article called New Insights into Intellectual Disability Genetics Emerge at Mount Sinai. Um, it's an article that I found while researching, and it talks about a study from the Icahn School of Medicine in Mount Sinai and how they published in Nature Genetics, which is about a new genetic variants linked into intellectual capacities and educational outcomes. The research in this article highlights the significant role of tandem repeats, which essentially are sequences of DNA that repeat multiple times, while influencing intellectual functioning. When these repeats expand, they disrupt gene function and impact cognitive abilities and development. To recap, the research of the genetic factors can influence intellectual capacities and potentially lead to better tools and new therapeutic approaches for people with intellectual disabilities. And here's the link to the article. Additional information. Do you want to learn more? Here's the link for a video called Adapting Activities, and with this video, we can get a deeper glimpse of how to efficiently adapt activities for individuals with an intellectual disabilities. Here's the link. It's just a quick video. The introduction. It's made by the Inclusion Club.
And to look at
And
some adaptations to address these assumptions. But first, let's just consider a bit of teaching theory. Now, just a bit cognitive hardware to construct their own learning discrete. Over time, try to keep the instructional place the same in terms of how they are the laws to depict what's going to happen. Now, these can be simple symbols or images, and this sort of technique is used widely in special education.
has great tips on how to adapt activities. Next, we have this web page called Inclusive Teaching Intellectual Disability by ADCET. In this website, we can see the impact of intellectual disabilities as well as some more in-detail strategies to create a more efficient and inclusive learning environment. Here is the link to the web page where it has all of these different tabs and resources. Has the impact teaching strategies right here, as well as assessment strategies. And it has another tab with assistive technology. And it's a great resource. Next, we have this informational text called Intellectual Disability by the Center for Parents' Information and Resources. This informational text provides advice or tips for parents and teachers and how they can support and understand their student with an intellectual disability. Here is the link, and it's highlighted here on tips for children, for the parents. And then here's tips for the teachers. It's just informational stuff with adaptive skills. And yes. Next, we have 3 characteristics. The first characteristic of an intellectual disability would be below grade level. Students with an intellectual disability are usually below grade level in reading and learning basic math skills. The other would be memory. Students with this type of disability usually have difficulty remembering information and tend to develop a short-term memory. These individuals tend to have a hard time remembering a specific sequence of job tasks or following instructions. Then we have loss of interest. Individuals with intellectual disabilities often have difficulty keeping their attention and learning tasks and end up losing interest in learning um any problem-solving tasks. They also tend to have a short attention span. Next, we have other areas of interest. First area I'd like to talk about is assistive technology. Technology tools like communication aids, adaptive computers, and mobility devices can enhance independence and participation for individuals with intellectual disabilities. We then have supportive employment. Helping individuals with intellectual disabilities find and maintain employment is key for individuals to feel independence and to also raise their self-esteem. This often involves coaching or incorporating adaptive strategies. We then have early intervention programs. These types of programs usually focus on providing support and services to young children, typically from birth to 3 years old, and their families. Early intervention can dramatically improve developmental outcomes and help children reach their full potential from a young age. I then provided this infographic on how to help someone with an intellectual disability. Just a couple tips or steps you could take, like providing patience, clear communication, offer support, encourage their independence, utilize visual aids, celebrate their achievements no matter how small. Every achievement is an achievement. Seek professional guidance. If you do not know how to address someone or how to help someone, you can always seek out professional guidance. Promote inclusive social interactions. Lastly, we have the references from all the with all the information that I've used for some of my slides. Thank you.